Welcome, my dear friends. I welcome you all. Welcome. Myself is Professor Dr. Deshpande. I would like to welcome you all in this today's interesting video. This is regarding the surgical instruments. And this topic is very useful for the fourth year BMS students. Fourth year BMS students, they have the subject Shalya Tantra. And in that particular subject, in the practical examination of any university, they keep some instruments for the spotting, or they can take their viva, oral questions on identify this particular instrument, tell me the parts, tell me the uses. So main thing is to identification by the name and telling the uses of that particular instrument. So this video is definitely useful for all the students. Myself is Professor Dr. Deshpande. I am MD in Ayurvedic Medicine and MD in Ayurvedic Physiology. My WhatsApp number is 922681060. Okay, so let us begin with this video. So first instrument is a kidney tray. This is a kidney shaped. The types are the plastic type kidney tray, aluminium or the stainless steel. There may be 300 ml capacity, or they may be medium type 540 ml capacity, or 1080 ml, that is 2 pints. We know when we put the saline, we usually talk in terms of the pint. So pint is a one bottle. So uses of that kidney tray is to collect the vomiting material, urine, pus from the abscess, to collect the fluid during the tapping, pleural tapping, ascitic fluid tapping, all these liquids that we can collect in the kidney tray and dispose of as a biomedical waste. So next is a scalpel and blades. So there is a blade number, handle number and the uses. So blade number 10, it is attached to handle number 357, and this is used for the stab incision and pediatric surgery. Pediatric surgery, yeah, okay. So blade number 11, again handle number is 357, stab incision in adult, incision and drainage of the abscess. Blade number 11. Blade number 10, pediatric for the small children. Blade number 12, handle number 357, tonsillectomy, cardiovascular surgeries. Blade size is increasing. Blade number 15, handle number same 357 for the plastic surgery, or it is also used sometimes for the pediatric surgeries. Blade number 22, 23, 24, but handle number is 4. Skin and deeper incisors are taken with this blade number 22, 23, 24. Okay, so these are the scalp blades. Handles 3 and 4 number are short and wider. 5 and 7 numbers are long, but the breadth is less. Sterilization is done by boiling or autoclaving. Blades can't be sterilized by heat. They lose their sharpness. Sterilized in the chemicals like Lysol for the period of 12 hours. Before use, it is cleaned with normal saline because Lysol is irritant. Scalpel handles, number 3, number 4, then 3 large and the 4 large. Alli's tissue holding forceps. Alli's to hold the tough structures like the fascia and aponeurosis, to catch the scrotal skin during the Lord's plication, to catch the bladder wall, to catch the bigger tumors. Alli's tissue holding forceps is used. You can see the Alli's tissue holding forceps. You can see the grip also. Okay, tough structures. Then Kocher's forceps, another names of the scientist, Kocher's forceps, to secure the hemostasis in the scalp region, on the palm and the sole, to catch the bleeder, to crush the muscles, to hold the pedicles of the piles. Kocher's forceps. You can see the Kocher's forceps. Lanny's tissue holding forceps. Lanny's tissue holding forceps to hold the bulk of the tissue, to hold the spermatic cord, to catch the lymph node, lipoma, cyst, big, to catch the glandular tissues. So here, Lanny's big material. Okay, Lanny's tissue holding forceps. Babcock's forceps, very famous. Babcock's forceps to hold the appendix, to hold the stomach or the intestine, to hold the tubular structures like urethra, fallopian tubes and vas deferens. Babcock's forceps. Babcock's forceps. Swab holding forceps. It is also known as the sponge holding forceps. It is commonly 9.5 inches in the length. Swab holding forceps use is for painting in surgical procedure. Before surgical procedure, you have to sterilize that particular part. In the absence of pile holding forceps, it is useful to hold the piles as well. So by the swab holding forceps, it is alternative use to hold the pile. Okay, this is swab holding forceps. Chetal's forceps, Chetal's forceps, called as a sister forceps. Sisters. In the hospital, we have the sisters to put the saline and all these things because it is routinely handled by the most of the time sisters. So, Chetal's forceps is sister's forceps. Sterilized in autoclaving or Savlon, kept in Savlon filled infusion bottle, always there. You can see the near the patient's cot or the bed. Useful to hold the cotton, gauze or any other instrument which is useful for surgical procedure. Chetal's forceps or sister's forceps. Hemostatic forceps to catch the bleeder point. Hemo means blood. Static means to stop. We have to stop the bleeding. In absence of the sinus forceps, to open the abscess cavity by Hilton's method. To open, okay, to crush the base of the appendix before excision, to catch the peritoneal margin during abdominal surgery. Hemostatic forceps. Hemostatic forceps. Dissecting forceps, plain dissecting forceps and tooth dissecting forceps. Plain dissecting forceps to catch the soft tissue and delicate structure. Useful for blunt dissection. Blunt. Tooth dissecting forceps are used to catch the hard structures, to catch the stitch during the excision. So this is dissecting forceps. Sinus forceps, similar to the artery or hemostatic forceps, useful for the drain the abscess cavity by Hilton's method. In incision and drainage, I&D, to break the loculi. Sinus forceps. Sinus forceps. Mayo's scissors. Mayo's scissors, known as a dissecting scissors, used to cut the tough tissue, hence it is also called as a tissue scissor. Used to excise the skin in circumcision, episiotomy and skin grafting. Mayo's scissor. This is Mayo's scissor. Retractors, to take away. Retractors, L retractors and C retractors. L-shaped, L retractor, single blade retractor. Useful during the operation to expose the operation part. C retractors, two blades on both sides, useful during the operation to expose the operative part. Abdominal retractor, self-retaining retractor, to split the abdominal structure. Heavy instrument which having two blades. Doyen's cross-acting towel clip, useful in draping in operative procedure to catch the towel. This is another instrument, abdominal retractor, first 3 lines, then towel clip. Useful as a tongue holding forceps. So this is abdominal retractor. Next is a flatus tube, length 30 inches, longer than the catheter and shorter than the stomach tube. What is the difference? Flatus tube is longer than the catheter but shorter than stomach tube. Flatus tube diameter 1 centimeter. Cleaned with soap and water, no need to sterile. This is flatus tube is used to evacuate the flatus in post-operative procedure. Used in large bowel obstruction. Flatus tube is used to reduce the gaseous distension of the abdomen. Flatus tube. Proctoscope. Proctoscope. Scope means to see. Whole anal canal examination is done by proctoscope to detect any pathological condition in the anal canal like intestinal piles, ulcers, growth, etc. For the biopsy of any growth in the canal, proctoscope is just accessory instrument. It's not a main instrument for biopsy. Don't get confused. In internal piles, proctoscope is used for band ligation, indirectly useful. This is proctoscope. Proctoscope sheath and obturator. Obturator, proctoscope. Sigmoidoscope, useful for examining the whole of the rectum and a large part of sigmoid colon. Two types sigmoidoscope, rigid stuff and flexible, useful to detect any pathological condition in the rectum and the lower part of sigmoid colon. Sigmoidoscope is useful to take the biopsy from any growth in the rectum and sigmoid colon. Indirectly useful, remember. This is sigmoidoscope. Humby's knife. Humby's knife, known as a skin grafting knife, used to take a skin graft from donor site. One mark of Humby's knife is approximately 0.75 centimeter. So this is Humby's knife. Trocar and cannula. Trocar and cannula, two parts. Inner sharp part is a trocar and outer blunt part is cannula. Trocar cannula. This is trocar, this is cannula, used to drain hydrocele fluid. Trocar and cannula. Can you see? Inner sharp part is a trocar. So this is trocar and this is cannula covering. Pile holding forceps, hemorrhoids, piles, similar to the sponge holding forceps, provide good grip to catch the pile during hemorrhoidectomy, to cut hemorrhoidectomy operation. This is pile holding forceps. Catheter types. What is catheter? Is a hollow tube, usually flexible with opening at both the sides. Types according to the mode of working: simple or non-retaining red rubber catheter, or self-retaining, that is Foley's catheter. According to use: nasal catheter, endotracheal catheter, suprapubic catheter, and urethral catheter. Types according to the material: plastic catheter, rubber catheter, silicone catheter, elastic catheter, and metal. Not nowadays. Nobody uses the metal catheter. Suprapubic catheters: ordinary catheter, simple rubber catheter, condom catheter, K90 catheter, and in self-retaining, common is the Foley's catheter, Malecot's catheter, and metallic catheter cross. Now, not nowadays. Red rubber catheter. It is made up of red rubber, that is Indian rubber, and radio opaque. That means X-ray cannot pass due to the lead oxide contained. This catheter is available from 3, 4, 5, 6 up to 12. 3 to 12 number size. Number 8 and number 10 are mostly frequently used. Average length of catheter 37.5 centimeter. Red rubber catheters. Okay, so you can see the red rubber latex catheter over here. Here also. Next. Advantages: most flexible, cheap, easily available. But disadvantages are repeated sterilization makes it hard, can't pass through the stricture, urethral stricture, it cannot pass. Irritant, infection sometimes, and catheter fever. Indications for the red rubber catheter: diagnostic, to collect the contaminated urine, to measure the residual urine, to difference between the retention of urine from suppression. Before pelvic examination in female, to empty the bladder, red rubber catheter is used. Therapeutic uses: irrigation, washing of the bladder in acute condition of retention of urine in post-operative condition. Other uses: tourniquet for the fingers, varicose vein of lower limb to tight, as a suction tube, as a flatus tube, as a O2 tube, as a rectal catheter for enema, tension suture in case of the burst abdomen. So many other uses are there of red rubber catheter. Self-retaining catheter, ballooned catheter, that is Foley's catheter, two-way or three-way. Hematuria Foley's catheter, used in the hematuria, blood in the urine. Non-ballooned catheter, that is Malecot's catheter. Foley's catheter, purpose of the balloon: self-retaining and hemostatic, to stop the blood. Foley's catheter is soft, less irritant. It can be used for a prolonged period. Disadvantages: sometimes softens, causes the collapse of the catheter. It gets automatically out, collapse of the catheter. It doesn't work. It doesn't retain over there. This is Foley's catheter. Can you see here? Urine drainage port, balloon part, okay? Then bladder openings. Foley's catheter indications, same as the simple rubber catheter, to empty the bladder in acute or chronic conditions, to maintain for prolonged period, in preoperative period to prevent the post-operative retention like in the hysterectomy, uterus, removing of the uterus, in patient of burn management to calculate the urine output. These are the different varieties of the Foley's catheter, three-way, two-way, etc. Indications continued urinary incontinence for draining purpose, hemostatic after prostatectomy operation, removing of the prostate gland, irrigation, washing of the bladder, treatment of partially ruptured urethra, selection of the size of the catheter, clear urine drainage, 12 to 14 Foley's catheter, cloudy urine drainage, 16 to 18 Foley's catheter, clots and debris containing urine, 18 to 22 number Foley's catheter. Malecot's catheter, non-ballooned, self-retaining catheter made up of red rubber. Tip has a 4 filaments. 2 are long, 2 are short, remain bulged and provide self-retaining device. This is Malecot catheter. Indication, intercostal drain in liver abscess. As a catheter in females, especially in the obstetric patient during the delivery, because Foley's causes the obstruction to the delivery path. So Malecot is preferable. More chance of infection, disadvantages. Malecot's catheter, more chances of infection, irritation, false passage, not a self-retaining catheter, so patient may pull it out. But Foley's catheter cannot be removed. Urethral catheterization, 12 number Foley's, 14 number for children, 16 Foley's catheter for female, 18 Foley's catheter for male, 20 to 22 Foley's catheter as a hemostatic to stop the bleeding. Retention. Okay, so what is the difference in retention and anuria? Retention, intensive desire to pass the urine with suprapubic pain but failure, cannot pass the urine. Anuria, there is neither desire to pass the urine nor there is a pain. Retention, full distended bladder, you can by inspection and the palpation you can see. Anuria, bladder is not full. Retention, catheterization evacuates the bladder, but in anuria, as there is no urine formation, catheterization, no urine will come out. Gastric aspiration tubes, next instrument in surgical instrument, we are talking about Shalya Tantra surgery instruments. Stomach tube, 30 inches long, red rubber tube with a diameter of 30 to 35. It should be passing through mouth and not through the nose because of the large diameter. Advantages of gastric content taking out, fast and complete aspiration, large particles of food especially easily aspirated. This is gastric aspiration tube. Indication, stomach wash in poisoning, organophosphorus poisoning, alcohol poisoning, food poisoning, antiseptic wash. But where it should not be used, contraindication, acute corrosive poisoning, no gastric aspiration. H2SO4, okay? Sulfuric acid. Esophageal varices, don't use it. Cardiovascular system problem, don't use it. Respiratory system problem, don't use it. Universal antidote of the poison. What is that? In the oral question, charcoal 2 parts, chalks 1 part, coffee 1 part. Give it to the patient. Rice tube, that is nasogastric tube. Old rice tube was a red rubber tube. Now rice tube are made up of the polyvinyl chloride, PVC, polyvinyl chloride. Size 10 to 12, sorry, 10 to 20. Length 110 centimeter to 120 centimeter. Old rice tube was 75 centimeter. It is blunt to avoid the trauma and having 3 metal beads. Rice tube, nasogastric tube. Metal is a radio opaque so that X-ray can find them. It facilitates the swallowing due to the weight of that metal. Sterilization, ethylene oxide gas or gamma rays irradiation. Boil. Ideally, rice tube should not be cleaned with water. It is not necessary to sterilize it because it is already sterile pack is there available. Rice tube, nasogastric tube, body. There are 4 markings. First marking is at 40 centimeter from tip to mark the cardioesophageal junction. It has reached up to cardioesophageal junction, heart and esophagus. Second point, 50 centimeter from tip shows the tip that has been reached into the stomach because you are passing slowly. Third marking, if you see the third marking over here, that means 50 centimeter have been passed and that particular tube is in the pylorus, okay, pyloric end of the stomach. And fourth, if you see the fourth marking over here, that means 65 centimeter is inside from the tip and it has been reached, rise tube has been reached to the duodenum base. That base of the rise tube provides with one Trocar cap. Size of its lumen is just adopting the nozzle of syringe because we have to push the material to the syringe. Indications: stomach aspiration for gastric content like acid peptic diseases, gastric juice analysis. Now it is very rarely done. Acute dilatation of stomach, post-operative vomiting, feeding, most essential part in the comatose patient. If RT aspiration with blood stain, it indicates injury to the stomach. Be careful. In alcohol poison condition, pseudo pancreatic cyst, that is Bell's sign. Rise to complication, rhinitis, because it is passing from here, nose, esophageal ulcers, and upper respiratory tract infection. Removal of the RT, rise tube. At first, inject some air into the tube to empty it from any secretion. This prevents the aspiration into lungs and gently draw out the rise tube. After that, it should be covered with gauze piece to prevent the complications. Next instrument, infant feeding tube. It is a thin nasogastric tube used for pediatric patients. It is very soft, made up of polythene and length according to the size. Size from 4 to 12. It is blunt tube. There are 3-4 side holes for the aspiration. Uses: infant feeding tube is the same uses like rise tube in pediatric patient. For sinogram, to inject dye into the sinuses, and also in fistulogram when external opening is small. This is infant feeding tube. This is all. All these are the surgical instruments that I have discussed today. And this video is very, very useful for all the students of BMS, MBBS, BHMS. And I request all of them, please, if you want such type of the, what you can say, the private classes, private tuitions, if you want anything, students, doctors, and patients, they can WhatsApp me 922-6810630. I can provide paid services, PPT as per demand, audios as per demand, videos as per demand, and online classes, online consultations. My dear friends, thanks for giving support to all these my activities. Please like this video, share with all your friends, all friends of your college, and please request on behalf of me to subscribe my YouTube channel. I am very much thankful to you and I wish you all the best. Please take care and bye-bye to you. See you. All the best. All the